So a little bit about blood administration, which we already talked about the other day. So remember, your universal donor is O blood, universal receiver is AB. When we give blood, we always have to have a consent. Another nurse needs to compare and identify and document that we have the right blood, it's not expired, we have the right patient, we have the right blood type. Those are things that two nurses need to confirm. 90% of all blood administration problems caused by the wrong blood. Blood tubing. Everybody knows we use Y blood tubing with normal saline. No other solution with blood except normal saline. We use Y tubing. So the blood tubing can be used for 2 units of blood or 4 hours, whichever one comes first. So if we're giving lots of blood over a short period of time, only 2 units per blood tubing. If you get done with 2 units in 3 hours, you can't use another unit with that tubing. So 2 units or 4 hours is a maximum. Packed red blood cells, we have to start packed red blood cells and RBCs 30 minutes after receiving the blood. They're usually about 300 mLs in each bag. It has to be infused within 4 hours. If we're not all the way infused in 4 hours after starting, then we stop the blood and we don't give any more. And then on the documentation that goes back to the lab, if it was a total amount of 300 but we only gave 250, then it'll ask you how much was given. So you can put in only 250. Must be given in 4 hours. We start slow. We stay with the patient. We have done vital signs before. Checked vital signs. We can increase it after 15 minutes. We can give blood either gravity or on an IV pump. Either way. We don't add anything with blood. We don't have a piggyback with blood products. It goes by itself. If a patient is on dialysis and we have to give blood while the hemodialysis is going on, the hemodialysis nurse can add the blood right into the hemodialysis, which makes it very convenient. You don't have to give it through the normal way, but they can add it in hemodialysis. So fresh frozen plasma, you can infuse that as rapidly as possible. So the types of reactions we get are usually febrile reactions. So they run a fever, things like that. So we can give the patient Tylenol or aspirin before, if they're a chance they're going to have that. So we can do that one. If they're going to have a really bad reaction, then maybe patient will get some steroids if they have a reaction. So different kinds. Hemolytic is usually the blood's incompatible, so lower back pain where the kidneys are, tachycardia, nausea and vomiting. That one happens pretty quickly. As soon as that blood will hit the kidneys is when you're going to usually have that reaction. So usually all those kind of things. You can give patients Benadryl if they're having the itching. A bad case of a reaction would be a patient that goes into anaphylactic shock. So any reaction in the textbook world, NCLEX world, we stop all infusions if they have any reaction. In the real world, we may be giving the patient Benadryl and continuing on, may give them the acetaminophen, different things. So textbook world, we always stop with the reaction. Another kind is a bacterial. The blood was contaminated, so you're obviously going to run a fever, chill, so you have an infection going on. That way, if that's bacteria, you'd have to do a blood culture, give them antibiotics, give them fluid, things like that. Fluid volume overload. If a patient's getting more than 1 unit of blood and they've got heart failure, or you don't want them to increase fluid on the lungs, so crackles will increase, maybe give Lasix between the infusion. corticosteroids could be given. If somebody goes into shock because of a reaction, then going to do different procedures to maintain blood pressure. So fluids, isotonic fluids, medications to keep their blood pressure up. That would be important as well.